It's not even that it's deliberate or malicious. It's not like, these women, we're not going to do this. It's just because the people doing the things for so long and for centuries who've been building all of the things have historically been straight men.
What a crazy world that we live in that torture is normalized. They put the balalaika in a capsule and he takes some Effexor. And so after that, they were like, okay, we're managing women's hormone-related symptoms in perimenopause and menopause with antidepressants or painkillers. All of that got built into this bias for the next 20 years. And so many women then died from not having access to the care they actually needed because everybody said estrogen kills you, when it's the exact opposite. Hi, everybody. Welcome back to Off the Charts. You know who I am, Bobby. If you don't, hi. I am talking, we're going to kiki with Kaz today. My favorite thing in the world to do is talk about feminism and feminism medicine. And I could think of nobody better than Kaz Twomey herself to rep womanity, feminisms. I mean, if there was a drug, we'd call you Feminismab. So welcome to the podcast. Yeah, I feel like I really just want to spend some time talking to somebody who I normally kiki about this with. And that one of the things I really want to talk to you about, because you speak to so many people, there's so many women you know who've gone through so many different things. And one of the things that I want to bring up is sexism prevalent in medicine, according to you, your experience, and people you know, and what you know?
It is literally all we talk about. That's all we talk about. We just came from a brunch with a friend as well. The entire conversation was about women basically in getting bad care.
Why is every conversation at every brunch
And it just comes up, she didn't even
that
bring it.
includes a woman always have to bring up a horror story that happens to her? And like, it happens all the time.
Sorry, some of the conversations at brunch is we had to stop talking because some of it was so bad.
Yeah.
Like, it was literally, oh, that's so heartbreaking.
We were gasping, and it's just keeps happening over and over again. So many of the women listening and watching this will totally understand because it's happened to you, and you bring it up with your girlfriends, and you try to bring it up with medical providers, and yet you still end up hitting a brick wall.
Yes. And also talking about like sexism and misogyny in medicine. And as we're always saying, it's the same with like racism. It's not just medicine. It's the building blocks of the entire world. So it's every single thing. And I was telling Bobby that I'm reading this book at the moment that I would encourage everyone to read, specifically doctors. I think it's a brilliant book. It's called Invisible Women, Data Bias in a Male World, something like that. Brilliant. Great audiobook. But I was reading the preface of the book is whatever, one page. I wanted to read it on the podcast. This is essentially everything we're talking about.
Go for it.
Just in one thing. Most of recorded human history is one big data gap. Starting with the theory of man the hunter, the chroniclers of the past have little space for women's role in the evolution of humanity, whether cultural or biological. Instead, the lives of men have been taken to represent those of humans overall. When it comes to the lives of the other half of humanity, there is often nothing but silence. And these silences are everywhere. Our entire culture is riddled with them. Film, news, literature, science, city planning, economics. The stories we tell ourselves about our past, present, and future. They are all marked, disfigured by a female-shaped, absent presence. This is the gender data gap. The gender data gap isn't just about silence. These silences, these gaps have consequences. They impact women's lives every day. The impacts can be relatively minor. Shivering in offices set to a male temperature norm, for example, or struggling to reach a top shelf set at a male height norm. Irritating, certainly, unjust, undoubtedly. But not life-threatening. Not like crashing in a car whose safety measures don't account for women's measurements. Not like having your heart attack goes undiagnosed because your symptoms are deemed atypical. For these women, the consequences of living in a world built around male data can be deadly. One of the most important things to say about the gender data gap is that it is not generally malicious or even deliberate. Quite the opposite. It is simply the product of a way of thinking that has been around for millennia, and therefore a kind of not thinking, a double not thinking even. Men go without saying, and women don't get said at all. Because when we say human, on the whole, we mean man.
My God. Okay, I'm a man. You read a part. I've never heard that before, but this is how I try to live my life. So I used to, at my last clinic, keep the temperature of my room because I had control over the temperature of the office. I used to keep it frigid because I got too hot. And all of the other providers, there were 23 of us, 22 of them were women. The number of times that one of the female providers, if you're watching this, I'm really sorry, actually just registering that now, then I would keep it cold because I got too hot and I just got uncomfortable. And then they would be wearing coats or they would be wearing extra layers and they would all be saying just like, Bobby, it's so cold. And I'm like, but I start sweating.
Everyone having pneumonia.
I know, actually. Like, oh my God, come to think of it, I gave out antibiotics I can't do that year.
Oh my God. Cha-ching. But I mean, like, whatever, there's stuff to learn everywhere. Like,
100%, but like even that, these are the kinds of things like there's bias built into everything.
everything.
Every time a woman asks for somebody to work her up for her fatigue, there's bias built into whoever it is. It could be a female provider, it could be a male provider. It doesn't matter.
Yeah.
Because the bias is already built in against her.
Yeah.
Because that's just how our society operates as it is.
It's not even that it's deliberate or malicious after them. It's not like, these women, we're not going to do this. It's just because the people doing the things for so long and for centuries who've been building all of the things have historically been straight men. So they're thinking a certain way. They're not, everything is just a certain way, and then it just becomes normal, and then that's just how it is.
Yeah, because then the people who are in positions of power, who end up being straight white men most of the time, and historically have been, who have decided what happens, what gets funded, who gets tested, how they get tested, how it ends up being put on the table as what you even discuss at that meeting. There's millennia of people being ignored. The female-shaped figure that ends up not being represented because there's complete silence about it because nobody ever brought it up in the first place.
Yeah.
I want to talk to you about very specific things. Okay, like let's talk about concrete examples. Do you have any concrete examples that you think represent this?
It is brilliant. I would say, though, I need to preface a lot of this is a lot of these are our friend's story, but one of them I've asked if I can use as an example today because it's very recent. They will remain nameless, but love you.
She who has no name.
So this person is pregnant at the moment, 6 months pregnant, living in a different country, so it's a different healthcare system. And I'm always thinking, like, I live in Canada, but I'm from Ireland, and there's very different things happening there for very different reasons. So she's 6 months pregnant. She has stage 4 endometriosis. So coming with that into pregnancy is a lot. It's already high risk with different stuff. Was anemic. And for me, something as basic as iron has taught me so much about how women get dismissed.
Yeah.
Because until I met you and I'd iron problems or whatever, I was always just told women have low iron. That's what doctors would just tell us, women have low iron. So I was like, women just have low
Well,
iron.
the irony of somebody even saying that, saying women have low iron, and then just full stopping there.
Yeah.
Deal.
Yeah. So then my friend was incredibly anemic, which is obviously, I don't think you need to be doctor to know it's due to endometriosis that's going to cause it.
You bleed too heavily, you're inflamed, you literally can't absorb it. The lesions of this terrible chronic problem are completely debilitating every tissue in your body. How the hell are you expected to actually operate normally? And the normal for women is already iron deficiency.
Yeah.
Add on this disease on top of that.
Yeah. It's already a deficiency.
Yeah.
So she was getting really, really bad anemia, really, really bad anemia. And then it got to a stage where it's like, it's dangerous. You're almost coming to the point where you said you can't get it after 30 weeks pregnant.
You can't
Transfusion.
possibly increase your iron stores after 30 weeks of pregnancy because the baby is demanding so much per day to grow. And that's the point. And there's nothing you could possibly eat. You could try to eat 14 steaks that day if you wanted to. And your body's going to say, nice try, honey, but that iron is not going to get passed. And the iron that does, it won't even be enough to make up for the demands of a baby.
Yeah. Yeah. I just feel like there's women I could pick and you could follow their entire life. If they have PCOS, they have endometriosis, if they have, I don't know, various other conditions that women have, you can just follow their life and it is going to be marked by medical dismissals. It feels like when I'm listening to it, it feels like it's like torture for them. That's what it literally sounds like torture. And you just get used to it because that's just the entire system.
What a crazy world that we live in that torture is normalized.
It's literally normally.
It's like the Geneva Convention needs to change its rules.
So sorry, this is a real life story. My friend, she was finally begging for an iron transfusion, was getting one last week, and messaged me after the iron transfusion saying, oh, it seems like one of the nurses is just getting trained to do this right before it happens. I'm not a doctor. I'm not even in a medical field, but I know a lot about iron transfusions from you. Some of it's so basic that I'm like, how do they not know this? And then my friend gets her long-awaited iron transfusion because she's, it's very serious. And then they fuck it up and they basically move her while she's getting a transfusion. She then gets a permanent, you can explain it, but she gets a permanent stain on her arm. And then the hardest thing is that she doesn't get the transfusion in the end. They can't finish it. So she's still anemic.
There's so much there,
Crying.
and it's one of the, like, example stories of how things like this happen. A person with endometriosis, ends up not getting proper care prior to conceiving. Everybody knows that they have endometriosis. They're in the journey to try to have a baby. Somehow, they miraculously are able to conceive despite this condition, right? Then they're like, "Girl, you're pregnant. Amazing. Congratulations." And then they leave her alone. They don't monitor her properly. They don't look at all the things that could be a factor from having had the endometriosis before that could inform the pregnancy, and then wait for her to complain enough. This person said they couldn't get out of bed.
Because you're tired.
You're tired. Couldn't get out of bed. And debilitated as a pregnant person. And then they're supposed to somehow say, there must be a reason that this has happened to me. Can you help me figure this out? And they're like, okay, great. I had to advocate for myself to make that happen. Then they go in to get the infusion because somebody heard them, right? After they screamed or like whatever, long enough. Then they get the infusion. That gets up. And then they still leave her in this position that she was in the first place now weeks later. And now she's left with this crazy stain because they didn't take care of her properly. That in any world, that happens. All medical mistakes happen to all kind of people. But why does it keep happening on repeat to the same women
Yeah.
over and over and over again?
It's just, it keeps happening. Specifically, I feel like anyone I hear with endometriosis, it's like, it's so underfunded. It's so under-researched. Anything to do with women, like if you're asking a regular GP, honestly, male or women, so it doesn't matter if the GP is a man or woman, but or whatever, there's just such a lack of, it seems like curiosity. Not even like knowledge. I get you only learn it for however much you do in medical school, but like we live in a world where there's so much knowledge, there's so many books, there's so much research. What are they doing? I don't want to blame them because I like duck is a hard job.
My favorite example of this is what's happening right now with perimenopause and menopause. That 25 years ago, there was a study that showed that hormones were bad. And I've said this before in other different episodes, but I'll repeat it again here because it's worth repeating. We do a study that was like, oh, we should show how good or bad hormones are when we give them to women, because we've been giving them to women for decades at this point. It looks like they're pretty good. So then they're like, we're going to, because this is how studies work, we're going to pick the population that gets most diseased so we can measure the diseases that we think happen to women. So we're going to pick, instead of women in their 40s and 50s who go through perimenopause and menopause, and instead of women who get symptoms, because when you have symptoms, you then don't know if you're getting treatment or you're not in a study. Because like if you're getting hot flashes,
Yeah.
you know you are different than the group who's not getting hot flashes.
Yeah.
So you can't blind the study properly.
Okay.
So you remove women who are getting symptoms or you don't ask them about it. So now you have women who are not in their 40s, not in their 50s, who are not getting symptoms. So who do you have left? You have 60-year-olds and 70-year-olds representing women in the 40s and 50s. And then the population at the time, this is called the WHI, I know it's wild. The population at the time was in the late 90s and the early 2000s. The average woman in America, as part of the demographic that was chosen to be part of the study as a cross-section of society, was morbidly obese. So most of the women were obese. And then half the women were smokers because half the population at the time smoked. So not only did you not include 40 and 50-year-old women as the majority of women who were being looked at in the study, you needed to show who got heart attacks, who got strokes, who got breast cancer. So you gave hormones to women in the 60s and 70s who were morbidly obese and who smoked. And then you were surprised.
Iconic woman.
Iconic.
Iconic.
You were surprised that they got strokes. You were surprised that they got breast cancer. You were surprised that they got the diseases you were deliberately looking for and found the population they would happen in. And then what happens? Medicine goes and news goes, so the world goes, whoa, breast cancer and heart attack and stroke are higher when you give hormones to women across the board. And so nobody was allowed to use hormones anymore. So the hormone use of medications that are normally very helpful at preventing disease, very helpful at preventing stroke, very helpful at preventing heart attack, very helpful at preventing breast cancer, those are ripped away because they painted this whole group with the same brush. And so women in the 40s and 50s were now left to suffer. And they normalized torture again with, what are you going to do for your hot flashes? What are you going to do for your insomnia? What are you going to do for your depression? What are you going to do for your anxiety?
They did nothing?
They did. Antidepressants became much more normalized because if we can't give you hormones, because it's going to cause you to have breast cancer and it's going to cause you to have strokes and heart attacks, what can we give you to make you feel better?
I'm like a ball of vodka.
You
Literally.
They put the bottle of vodka in a capsule
Oh
and
my
said,
God.
honey, take some Effexor. And so after that, they were like, okay, we're managing women's hormone-related symptoms in perimenopause and menopause with antidepressants or painkillers. So we started painkillering women, giving them nerve painkillers, because if you're all full of zaps and you're all full of anxiety and your nerves are just all over the place,
Yeah.
you might as well just numb her. Just comatose her so that she doesn't, one, complain, and then two,
Blue. Sounds ideal.
how we allowed for this to happen. And then I started school at the time in 2003, and we're learning about all this stuff, and we were anything to do with estrogen, because estrogen was just revealed to cause strokes and heart attacks and breast cancer in these women. But of course it was, because it just explained why that would make sense. You gave it to obese people who smoked in their 70s.
You're 70s. So funny.
I know. And then you say anything to do with estrogen. Flax seeds, soy. Were you ever in a time growing up where, I'm a vegetarian, so it was very prevalent for me, where like soy was bad?
Sorry, I'm from Ireland. Do you think I knew what soy was?
Oh, never mind. She didn't eat
Soy?
any edamame. So when here and in the Western world, on I guess this side of the pond, uh, everything to do with estrogen, including soy, was no longer allowed to be something that you considered part of your diet because it was going to cause breast cancer or it was going to feminize you. So estrogen became the devil, and it villainized anything that had estrogen associated with it, even if it was literally in Asia showing nobody was getting breast cancer, actually it was being prevented.
Yeah.
Nobody was getting strokes, it was actually being prevented. Nobody was getting heart attacks, it was actually being prevented by the people who ate soy. But here, for some reason, it just seeped into, that makes sense. Estrogen is evil. And why did people think estrogen was evil?
Because it has something to do with women.
Exactly.
That doesn't surprise me.
Because women are evil.
Yeah, that doesn't.
Yeah, exactly. Eve is
Yeah.
like, burn her, because, and that in and of itself, how
Like you're growing up and it's like you run like a girl, you punch like a girl, and it's like girly.
all of that got built into this bias for the next 20 years. And so many women then died from not having access to the care they actually needed because everybody said estrogen kills you, when it's the exact opposite.
Has it changed a lot now?
No.
No.
So the subreddit stunning.
It's stunning. It's actually like when you're every time you're talking about like women's health or into women, you're like, yeah, actually, so there's no rainbow at the end of the.
No, the rainbow is black.
Yeah.
It's gotten dark. The storm clouds are still brewing.
Yeah.
Because the people who are calling the shots are the same people.
Yeah.
So how is it supposed to change?
Do you think like, is it stupid to say this, but like, do you think like social media has changed anything? Like, I feel maybe doctors are not more even educated now, but I feel like women are. Like, I feel women now of my generation are more educated about their health than generations before.
Yes, 100% true. I think that's probably because so many women now are not taking it anymore and actually know that's actually unfair to women before.
Yeah, no.
Yeah. So they're not taking it anymore, and they are able to access slivers of information that show them that's not true.
Yeah.
That's not true. So it's a combination of little slivers are breaking through, and they're like, oh, I read this thing about, or somebody taught me this thing about that, and I actually bettered that myself, and that's not true, doctor.
Yeah.
I should have access to this medication. I should be able to get an iron infusion. I should be able to get that test. And they're now like not taking it anymore. So like they're getting informed and armed.
And there's groups now. There's like, specifically for stuff like endometriosis, there's like kind of a lot of legislation, even in Ireland, trying to happen with it to get more funding.
Totally.
And I feel like social media, as bad as everyone says social media is, I do feel like for even during Repeal and any of these, like activism on social media for women and like community for queer and people and for women, it's really helpful.
100%. I think that that's this wave now of influencership, like Halle Berry and Oprah and all of the Nicole Kidman, all of the women were like, girls, we've been on these
Naomi Watts is doing a menopause line.
girl, we've been on these things for years. Where have you been? It's because you've had access. Some of you haven't, but you had access, knew about it, but it never trickled through. But it is now because you're finally talking about it because now it feels safe to talk about it. It feels like there's this upswell, and doctors, female doctors, now are becoming these incredible influencers online. The Dr. Jen Gunters, the Kelly Kaspersons, all of these wonderful now podcasters. They're constantly on Instagram as well, just sharing, 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 and saying, nope, not going to take it anymore. That's not true. And then other people who are now listening to them, who are seeing that they have a platform and then follow them, are like, no, I saw that this is not true, and then take that information to their provider and say, no, no, we can't do that anymore. Or come to a provider who actually gets it or who got it, and then say, can you provide that kind of care for me? Because I'm not able to get it elsewhere. There's definitely this like, but I said no originally because even now, like if 90% of women who are after the age of menopause are eligible for hormone therapy, as an example.
Mm-hmm.
If 90% of women are eligible, currently, after all this upswell, after all of this, like, everybody, these are fine. Like, think about your hormones and perimenopause. And currently, only 14% of women are offered.
Why?
Exactly.
14.
Yeah.
Jesus.
Why?
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 Why though? Why do you think? Oh, the other. These are stupid questions you're asking.
That's why. And it's like, so we asked the why question. Is this about like just ignorance in medicine and we're just not there yet? Is it about like doctors not being taught in school because they only get 1 hour in like female specific or female advocacy specific
Cutting
menopause?
insane. What
Oh,
I thought it's insane. Is that still the same?
they're now adding into curricula menopause specific training. There's this thing called the Menopause Society, and where it's all like where all of the information is gathered, and then conferences and all of the advocacy. They have a journal, etc., for understanding menopause hormone replacement therapy better. They still only have a few thousand members. There's a few thousand doctors on this blog.
No. I've been to all of them.
I know. Can somebody please listen to me? So no, that's telling, right? These numbers are puny. They're so small still because we have still yet this tsunami of women advocating online and getting into groups and making people try to listen. It's still not anywhere near where it's supposed to be, and it's because medicine is part of a misogynistic world. Medicine is sexist.
Mm-hmm.
Of course it is.
It's like one of the most sexist and racist institutions and whatever.
And how could it not be? How could you not be sexist or racist when you are born out of a society that is sexist and racist? Are you somehow immune? Did you take some kind of vaccine that made you immune to the literal energies that are part and woven into the fabric of our society? How'd you do that? Where'd you get that from? Who gave that shot to you? No one. So you're still at the mercy of these biases. You're still at the mercy of these prejudices. Like you said, you don't necessarily, mm, like, it's not malicious.
It just is.
It just is.
It just is. It's the same with everything. It's just the way the world is. You don't even know things are a certain way. There's even certain things I've learned from you. You said something like, I kind of never even thought that that was like, well, I just thought it was. It is what it is. It is. It's just, yeah, I don't know. It's wild. And I think in medicine, it is one of the biggest ways of the world to control women. So it's the biggest tool of the patriarchy is abortion. So controlling woman's body. And you see it happening as fascism rises. they pull away women's rights. What's the number one way to do that? Through their body, through medicine. It's happening in America. It's happening all over the world. It's good and bad in loads of different ways, but it is the number way in the world of controlling women is reproductive healthcare.
Yeah, because you don't want an educated woman not having babies. Because if she doesn't have babies and gets informed and is allowed to explore her brain in a society that's free, she isn't going to bear your children as much as you'd like for her to. And that is a bad thing. How do you then make sure she does? You control every decision she could possibly make about herself, or pretend like she has the freedom and then put roadblocks. Don't put funding for that study to even understand what happens there. So you get scared about it, so you don't do it. Don't give pain relief to women getting contraception like IUDs. Don't offer them pain relief when they're getting surgery, like an object shot inside.
I can't actually talk about this because it's so infuriating. IUDs, if Jordan Peele is looking for his next fucking movie, he can make one about IUDs. It's right there. It's terrifying. It'll be really horror.
Get it out.
See,
Get it out.
Just women scurrying. It's just like, you'll be fine, Mitch.
Like the shock of people not offering. So who made this up? Oh, first of all, who made up that the cervix doesn't feel pain?
I don't
Who made that up?
man.
Yeah. But like how even that became a normalized part of medicine to be like, well, the cervix doesn't feel pain, so you'll be fine. And you shoot this metal object or this plastic object up your vagina into your cervix and then have it be sitting in your uterus and you'll be fine, girl. Now people are offering inhaled pain medication on top of benzodiazepines to relax you, on top of a lidocaine block, on top of a nerve block.
And then before they were like, you'll be fine.
You'll be fine. So informed, trauma informed, and then just the fact that it's even trauma informed. Just offer the person medication to make it less painful, but you didn't. You put a roadblock in front of it so that you would make it so that it is a fear-based idea that every girl comes to me and says, no, my girlfriend had so much pain, I'm not going to get an ID, so I'm just going to go on birth control, but I hate birth control, oral birth control. I hate it. It ruins my brain.
Yeah.
It makes me depressed. Not saying that it does that across the board. Oral birth control is a wonderful medication used by billions of women. And yet some women think it's their only option because they are scared to use these other things because there was cock-blocked every step of the way. Not studied, not given money for, not properly explained. And then everybody is afraid of doing anything because they're just going to torture me anyway. So I don't want to do that. It's crazy.
Literally some of the worst stories I've ever heard is women getting an IUD. And I'm like, it literally sounds like Handmaid's Tale.
I mean, we're halfway there.
No, we're literally there.
Yeah, we're halfway there.
It's so annoying.
I do have to say though, like, as a man, it's so hard for me to hear even somebody like you say just most of the people that you know go through stuff like this.
Yeah.
Just,
But you know that you're like,
no, but it's still so hard to hear that it's just so okayed.
yeah.
I don't understand how do we get here?
I don't know, but it's like, it's bad. And I think when you see like even America now and stuff, like you just read the news and it's like they're overturning abortion, Roe versus Wade. All of these states are now making it like in some cases you can't have abortion at all, and it's just how quickly everything can be taken away from you.
Can you talk a little bit about your history, work, life around that, around abortion? Here comes feminism app, people. Here she comes.
I'm from Ireland, which had one of the strictest abortion laws in the world until I think it was second to Malta, which still has, I think, one of the strictest in the world. And it was in our constitution, which means to get it overturned, it had to be the government couldn't do it, like it had to be a vote. So I think it was 7 years ago, 2018, Ireland overturned our abortion laws, which was amazing. It was an incredible day. Literally will never forget it. One of the best days of my life. May 2018. And along with my friend Fiona, helped in a very small way because this was hundreds of thousands of people in Ireland just after we did Yes Equality for gay rights. So we helped kind of, I don't know what was the word, like gave Irish people a broader platform and try and get people together to do protests around the world. So if Irish people were living in Belgium, in London, in Australia, wherever. And I think it was literally just a spark that just gave people, because as you know, so many Irish people live abroad.
Yeah.
And we can vote if we live away up for after 2 years or something.
Okay.
So most of the generation who wanted to live away and then they couldn't vote. So it was just giving them a way to get to activate, which they did, and it was amazing response. And then I moved home, literally so I could vote. I moved home in 2017 and just became part of the other thousands of people protesting and activating to get the laws overturned. And it was so stressful for everyone involved. It was so like heartening, disheartening. First of all, it had been years of work from everyone, but like decades of trauma had built to that, from previous generations, from the Magdalene laundries, from all of these Catholic Church post-colonial horror stories in Ireland. I remember this guy who was the boom off or something just kind of said, just so flippantly, like, because it didn't mean anything to him. And he was just like, I don't think it's going to go through.
Oh, Jesus.
I was like,
Not the boomer.
I was like, oh, he was a young guy. He was like in his 30s. And I was like, what? And he's like, yeah, I think it's going to go through. Anyway. And I kind of moved along and I was just like, you have no idea what you're talking about. Anyway, it passed in a landslide, like 67%, which is insane. Because I think people understood that even though it was so full of shame in Ireland for various reasons, everyone still gets one. So it's like, do you want someone to get one safely? Or do you want a person to have to fly to a different country to get one?
Which is what happened.
Oh, it was 3 women a day from Ireland would have to fly to England to get healthcare because they couldn't get it here. And as we know, with abortion, it's not just, it starts with abortion, but like if you have a country that has limited abortion or very strict abortion laws, you're not seen as a person. So any other healthcare from that, forget about it. You're not considered a person. So you're not really going to be listened to properly. Your maternal care is not going to be as good. It just trickles and trickles down.
That is profound. That is profound. No, it is, honestly. It's like putting it that way.
It's that simple.
Yeah, it's that simple. If you take away that choice,
you've taken everything.
You've taken everything.
I'm taking everything.
What was the reason that set up that cascade of events that allowed Ireland to like, what happened to allow for everybody to galvanize to make this, to vote?
It was a lot of things. I think is our generation was just sick of it. And I think the Catholic Church had lost its grip. So we went from kind of, England colonized us to Catholic Church. It just became I think our generation was sick of it. And they were just activated at home. And like for the Yes Equality campaign, it's people on the streets doing it. Like the community and the activism in Ireland for everything is incredible. Like our generation and generations before, like the whole thing. But Ireland is a very political place. So I think that the people doing it for Yes Equality did such a amazing job, and that energy was still left over, and there were still change to be made. And I kind of it was a catalyst for it. But I remember when we were going around to doors and talking to people, and we were doing this TV thing the same day of the vote. Remember we knocked, like I was doing it around my small tiny hometown, which is a few thousand people, and
Still haven't been there.
you're never going. And then the cameras were like, they were looking for people who were no voters. It was Samantha Bee show, the full frontal. So they were looking for people who were they're lovely people. They were looking for people who are no voters to get a bit of a TV thing or whatever. And
like, no, we want abortion to not be allowed.
Yeah. No. We want abortion. We want the laws to stay as they are. We are not, we are anti-choice, whatever they've got. So they were trying to find that because they were like, trying to make a peace and couldn't really find it. And I was on a bit like, oh God, they're going to come to my small hometown and everyone's going to be like anti-choice. Who is so like Catholic Church. But honestly, it was actually like really emotional and they couldn't find us. They were actually like, we can't this because it was incredible. People were pulling like the producers and hosts like down an alleyway to talk to them and tell them their stories. So all they found was people trying to tell them their stories. And then we knocked on this like old man. He was about 85. And we knocked on his door and we were trying to use his power for a TV. And he was like, "What are you doing?" And then I was like, "Oh my God, here we go. Here's the guy now they're looking for. Adam. Found him, here he is." And then we told him what we were doing and it was for the vote and like la la la. And he was so emotional. And I remember he was just like, "I'm voting, I voted yes. I'm gonna vote." And we were just like, oh my God. Like it had just been people had heard stories for generations. People's mothers had been in Magdalene laundries in prison. That's essentially a prison for, unwedded pregnant women. So there was just a lot of trauma, I think, that had led to it. And a lot of yeah, it was just really surprising. And the fact that abortion rights got more votes than than gay marriage in our country, it got like 3% more, 10%. But like
It's still huge.
that's huge.
It's huge.
So that's how much people wanted to change. It's like if it can happen in Ireland, it can happen anywhere.
The thing that though that's so amazing, I'm proud of you for having been a part of all of that. What a momentous thing for people.
It was honestly an incredible day for everyone. Like, except for the couple of thousand anti-choicers, but
No, it's a wonderful day for them too, because like
they still can get healthcare now. So
because they're also the ones who need access to this kind of stuff.
I know.
They just at the time don't realize that that's going to be something they might need or had needed.
Also, to think of all these American male politicians, the conservatives, like they haven't been paying for abortions for.
Oh, honey.
Everything is.
Oh, honey. The number of times, which is just, again, blows this brain, that the conservative people, the people you're talking about, are way more likely to basically crash Grinder when they come to tower. Our Grinder ups just completely go black when a conservative convention comes to town. What is that about? The number of hits of trans porn on Pornhub go through the roof to the point that Google can't even kind of count those clicks anymore to even pay the talent when a conservative conference comes to town. These are the people who use and abuse the things that they are voting against every single time. They have demons, and so they become demonic in their control of other people because they wish that it wasn't part of them. They wish this wasn't something that they had to deal with, but they do. And the way they deal with it is by hurting other people, because it's the only way to big themselves up.
You ever said hurt people, hurt people.
Hurt people, Oprah. So like the same thing. That example of abortion, I'm not gonna get that out of my head now that you said that.
It's so simple.
Yeah, it's so simple.
It is when people are always like, I think I learned a lot doing activism for that or whatever, or just talking to every single person about it. Because it's like, I'm not normally talking to like all of these random people about this subject. But yeah, some people were just kind of like, why is this such a big deal? Or like, why? And it was just like, it's everything.
Yeah.
It is literally everything. It starts with that. And if you don't have that, you can't get anything else.
And we talk about privilege, right? Like a lot of people have the privilege of not having to think about this. A lot of people have the privilege of not having to they don't have to spend a second even contemplating these kinds of things because they're sitting on thrones of places where they're never going to be touched by questions like this. They're never going to be touched by inequality at the workplace. They're never going to be touched by maternity leave lengths. They're never going to be touched by whether or not a person gets access to medication that makes them not feel terrible when they have a painful period, or that somebody even cares if they're having a painful period. They don't ever have to think about it because they're sitting on velvet thrones all the time, and their privilege basically disables them from having to even think of the question. Why would they? How could they?
Like they don't have to.
They don't have to. Like it's Lady Gaga's song, if it happens to you. It's when it happens to you that you then get to see and then change your perspective on something. But until it does, it won't matter.
Yeah.
Ever.
I know.
And it's those throny people who are making decisions for everybody else. And that's why it's so important to have these kind of conversations, because who knows who gets to listen to somebody who's never heard this. And maybe it'll be really enraging for a lot of people. Maybe a lot of people are going to be like, oh, these two with their queer, feminist soapbox.
The bitches.
Not everything's about race. Not everything's about sexism.
Literally everything is.
Why you have to make everything about misogyny?
Because it is. And also, I honestly think this book that I'm like listening to at the moment, but it's factual. It is literally data about the world. I'm not even finished the book now, so I can't talk to it all. But like, it's stuff so simple about like how snow clearing is sexist, like clearing of snow. That's just a teaser you have to read out. That's a teaser you have to read.
Like, I'll be hoofed.
But it's literally like,
Open my shovel.
and it's just factual. It's just the way it is. It's not even like boo-hoo. It's just like it's literally fact.
What do you, as a woman, think should, could, would happen next?
I think that people in a position of power whose job it is to look after women, vulnerable people, trans people, queer people, anyone, specifically doctors and people in healthcare professions, because they're so stretched as well. Like doctors are so stretched. It's like it's incredibly hard profession to work in. The thing you said there about people not having to think about things. So like, if it's a straight male doctor and they don't really have to, everyone walks through the world in a different way. But if you are in a position of power where your job is to literally look after people, you have to see the world from every way. So read books. You don't know about menopause, bitch? Read about it.
Yeah.
Go to courses about it. Endometriosis, PCOS, iron. Because it's like, isn't that fascinating for you
No.
as a doctor? Are you not
For that.
Are you not curious?
I am.
Like the way men as well are not curious about periods. I'm like, if I didn't know about it here, but like, tell me everything about it, because it's a wild thing.
Yeah. Oh, it's
So where's the curiosity?
the beautiful jungle that is the Amazon of what happens to a woman during her menstrual cycle. It's beyond.
No, it's insane. That's why I'm like, learn about it. Every man should know everything about periods. It will make your life easier.
I remember it was a couple women at a party that I was at, and they were like talking to some guys, and the guys, there was some cackling happening, and then it's like, lots of like gay gasping and clutching of pearls. And then I was like, oh, what's going on? And there's like, okay, Bobby, come here. And they said, Bobby, where is the pee hole on a woman relative to her vagina? I was like, sorry, why are people asking me that question? And they're like, because we asked the guys, and I remember we're just like, they have no idea. I was like, hang on. And I was like, how? You're like, you're there. You're like, straight man, you're there. How do you not know? And then they were confused as to how many openings. Like, I was just like, I was so confused. How do you not know that curiosity? I was like, this is why.
There's no curiosity.
There is none.
There's none.
And it's the thing that I wish happens at the very beginning of any of my classes in school. I wished this is what happened. So if we're having a conversation about class 1, day 1 of gynecology, what I would love is for us to have the first 10 to 20 minutes discussing the history of gynecology, not going right into anatomy and nerve endings and blah, blah, blah. The history of gynecology, so that we get an understanding of just like, it's like this. So they're the forebearers, strange way of putting it, but the forebearers of gynecology of understanding were Black women, slaves, who were completely mutilated and abused and tortured without pain medication, surgically cut into to understand what the vagina looks like, what the uterus looks like, what the bladder looks like, and then sewed back up again and repeated over and over and over again by the same surgeon who was curious but had to use somebody. So he used black slaves. Jesus Christ. And it's so horrendous. If we learned at the beginning of gynecology class that story, name those women.
Like it literally started with torture.
Yeah. Name those women, speak to their story, and could anybody in that class ever look at that subject ever the same again? No. They couldn't. They wouldn't be able to. You'd be like, first day was so important to talk about the origins of our understanding of gynecology came from enslaved women who had no choice, who were tortured. And that's how we learned how to do fistulotomies. That's how we learned how to do surgeries on women, because it was understood through these. They're not even brave. They shouldn't have had to have been brave. They were tortured.
He had tortured.
Of no choice of their own. They didn't volunteer for If we learned in the first 20 minutes of every class the origins of anything, where did we learn this from? I don't think our brains would go on to day 2, day 3, day 4 the same.
Yeah.
I think we'd be like, I have a different colored glass that I'm looking at things with.
Yeah.
How could I not?
Yeah.
That's what I think would be so beneficial, because if you don't live the experience, like if you don't live the experience of like a queer brown person or of a woman, if you don't live the experience, how are you expected to know anything
Yeah.
unless you're told day one that this is where it came from?
Yeah.
Maybe that'll liberate you a little bit in terms of maybe when a woman comes in to see you, 10 years later, you have it so emblazoned in your brain, that story that you're like, I'll never do that to a person again. And so I'm going to make a decision to actively be anti-misogynistic, anti-racist, anti-sexist with every move I make, or at least possible.
To also become better at my job.
Exactly.
Like, it's just, it's so simple. It's like not, it's not as like difficult to think about. I've always just thought like, "Jeez, as a doctor, like a woman must be such an interesting puzzle."
In women, it's findable if you try. That if you don't try, you're not going to be able to find it. It might take a woman 7 to 11 years to be diagnosed with endometriosis.
Mm-hmm.
It might take a woman that long to be diagnosed. But why is that? Because one, we haven't trained enough ultrasound technicians to be able to identify endometriosis looking lesions. We overemphasize covering up the problem, like giving them oral birth control right away as soon as they have pain that is unbearable for them, that they miss school or miss work, that they end up just having it's the solution anyway. Do you want to have a baby? You're not going to have a baby? Go on pill. It's going to cover up your pain. It's going to cover up the symptoms that you experience from this condition. And then when you're ready to have a baby, let's talk. Did you just, like, how you don't hear what you just said? Did you just minimize this person and their entire experience for the next maybe 15 years, from the ages of 16 until they're ready to have a baby at 33, which is now the average year? Did you just minimize them and that entire time that they would just need to be on birth control? Meanwhile, there's a disease process that's brewing and potentially ravaging other parts of their body, that when you actually get them off of oral birth control, it then reveals itself to be the thing that's going to prevent them from having a baby?
I feel like you literally are talking about a few different people that I know, because it's like endometriosis is awful. Like, the more I read about it and learn about it, I'm like, it's so debilitating for women to deal with. I just feel,
Guess what percentage of women have endometriosis?
I would say 110%. 110%. If you don't have it, you're like,
Yeah. We should treat it like that, though.
yeah.
We should treat it like 110% of women have it, because then we take their pain more seriously.
Yeah.
It's about 20%.
Oh my God. Do more women have PCOS or endometriosis?
Well, we don't know the true numbers because PCOS, this is a very interesting question. PCOS has changed its criteria over the years. So endometriosis is like you literally have to go in surgically
To see.
to like open up parts of the body to then see, oh, there it is, and then kind of like get rid of it. Or if there's too much, you then suppress it. There's very few technicians that do sonography, like ultrasound, that can actually identify it just through imaging alone. MRIs don't do it, CT scans don't do it, X-rays don't do it. You kind of have to see, you have to visualize it, right? PCOS is different. PCOS used to be, you need to have these very strict criteria. And if you didn't have these very strict criteria, you don't get to get the label of PCOS. I don't care how much of a beard you grow. If you grow a beard as a woman, but you did not have high testosterone levels in your blood, or cysts on your ovaries that look like there were many to be consistent with PCOS, or irregular periods, like, listen, bearded lady, we'll see you next time you have another problem. Enjoy The Greatest Showman, because that's really probably going to job. That's how it was. So then they changed the criteria to be like, we're being a little unfair. That's very strict. Why don't we let them have 2 out of 3? So instead of exactly 2, they're like, let them have the beard, let them have cysts on their ovaries, and okay, that's enough. We don't have to do more than that. And then very recently it changed again. So be a more expansive and inclusive. That now means that a much greater number of women actually are being diagnosed with PCOS. We don't know the true numbers, but it's probably less than endometriosis.
Okay.
Because PCOS is not as prevalent as we understand endometriosis to be.
Okay.
Yeah, so
Why the two main, like endometriosis and PCOS?
probably. I mean, there's all kinds of other diseases that women suffer from that are very prevalent. Chronic UTIs is a problem. Like vaginal pain is a problem. Fibroids is enormous. There are upwards to the 40s and 50% of women in perimenopause. That
Lady Gaga that.
does she?
Fibroids?
Yeah, fibroids.
Yeah, she's somewhat that.
So there's all kinds of other things. It's just that PCOS and endometriosis are these like kind of unique ones where they're kind of both told cover them up, just bury them, get the biggest shovel you have, and bury it until she's ready to have a baby.
It's everything goes back to the baby.
Everything goes back to the baby.
Everything goes back to the body. Everything goes back to the baby.
Goes back to having the baby, or no, you're right.
It's the
Yeah, I was gonna say or something, and then I was like, wait, no, there's misogyny.
It's just that.
Or it's just that,
And that's it.
and that's it.
And that's it. And that's the tea.
That.
And that's the tea.
Thanks for kiki with us, Kaz. I'm so happy to have these kinds of conversations with people because it's so important that we do have them. We could go on for hours. I already know that I want to talk so much more about other things with you.
So when you were saying about what can people do and all this, like what you're doing is this podcast is like, I already know all the girls are going to eat it up.
Girl, you're right.
Everyone's going to be like,
Honey, sis.
into it, but like podcast like this, people need to informed people like you need to lead the conversations as well and allow space for the conversations and teach people. You have taught me more. I hate to say this. You have taught me more about being, not me, but like about being a woman, my experience about my body as the last night thing I'll ever say to you. This conversation is over.
You remember
Cut
that?
mics.
Because that was a gift.
Page cut the mics.
So, thank you everybody for watching. See you next episode.
Bye.
Thank you so much for joining me today. I really had a great time, and I hope you did too. Please share this with a friend or a lot of friends, and leave me a review. It really helps promote this podcast. Thanks so much.